This is Jenna Nikina on eyesurgeontalks. I wanted to discuss the symptom of distortion of vision. So this is one of the common things that I see in my clinic. Patients coming in complaining that their vision is distorted, twisted, that they can't read writing on a page because the letters are jumbled about, or some of them may be missing. Now, what is distortion of vision due to? Well, when we hear about distortion of vision as ophthalmologists, we often suspect a problem with the retina, because that is the very thin film at the back of the eye that has lots of cells called photoreceptors that pick up the light. They're like little pixels on a screen, and each individual cell will pick up the light, and together they form a picture to transmit to the brain. So any change, any physical change in position of these photoreceptors can result in visual distortion. And so, for example, problems such as an epiretinal membrane, which is some scarring changes in the retina, like a wrinkle in the retina that is a common aging change in the eye, or macular degeneration, which causes some sort of lumpiness and irregularity underneath the retina, can sort of stretch and twist the retina in ways that make it produce symptoms of distortion. The other time you get distortion symptoms is, for example, after experiencing a retinal detachment. So a big proportion of my patient cohort is retinal detachment patients. And here what happens is when the retina detaches, it stretches because it's really thin, it's really flexible. And the fact that it's kind of ballooning up and makes the retina stretch. And what that does is it moves the photoreceptor cells further apart. And then when we repair the detachment, and this is specifically the macular off-retinal detachment, so those that involve the central part of the vision, which is very, very sensitive to any perturbations. When we reattach that retina, it sits back down, but it doesn't go back quite in the same place. It doesn't assume quite the same shape that it had before it detached. And that means that the little photoreceptors, say in the good eye, they're still positioned like they were, but in the bad eye, they settle down further apart. And what that means is that any images, any pictures from the outside world, in the good eye are falling across, for example, 3 photoreceptors, and in the bad eye, they're falling across 2 photoreceptors because they're further apart. And that makes the image in the affected eye, that makes the image look a different size, because the same size of the object is stimulating a different number of cells. And so after retinal detachment, people often feel that the images in the affected eye look smaller. And the converse is the case with epiretinal membranes, because epiretinal membranes, they don't stretch the retina, they shrink the retina, they wrinkle it up, they kind of scrunch it up. And so in this case, these photoreceptors in the normal eye are like this, but in the affected eye are all scrunched together. And so the image will fall on more of them than in the good eye, and the images will look larger. And I think that's a fascinating little physics lesson that I love thinking about. It's just a sort of very visual, very clear, and it's just a pure mechanical effect in action. The macular degeneration producing distortion is a little bit different. Like I said, it's little lumps and bumps under the retina that can stretch it in different ways. And in that scenario, it's not a very regular or predictable effect. So images can look larger, smaller, or just straight lines that can look bent out of shape, and you get all sorts of effects with it. Sometimes patients will describe distortion and the retina is fine, but in these scenarios, we can sometimes attribute this to a cataract. Because what cataract can do is, if you've got layers of cloudiness in the lens of the eye, these layers can split the light differently, and suddenly you're seeing kind of almost like a double vision in one eye, or some distortion, bending of the light that's entering in. And some people describe this effect as a distortion as well. Those are the common causes for distortion. What can we do about them? See the other videos on my channel. for discussions of epiretinal membranes, for macular degeneration. There are some things we can do for some of these conditions.